All right, we will go ahead and get started, and there may be some people who join us. Um, Angela, is that Angela Rich by chance? You can ask questions in this little Q&A area here. If you have questions while we're in the middle of the presentation, that's totally fine. Um, and I know that there were some questions emailed as well. Um, so I will try and um, get to those also. So this is a seminar on reflex integration. And so I've done different ones on sensory processing in the past, but wanted to do one on primitive reflex integration. And if we were going to think of our children's development like a pyramid, and academic learning and behavior and normal daily living skills are all up at the top of that pyramid, reflex integration and sensory processing would be at the very foundation of that, of their development. And upon those two, reflex integration and sensory processing, upon those two foundational elements, all of the other developmental skills depend on those two things. So this is really a bottom-up approach to looking at a child's function. And so, yeah, I hope that my goal is that you learn a lot this evening. So, and okay. All right. So what are primitive reflexes? So babies are all born with reflexes that help them develop in infancy. They're automatic motor movement patterns. They develop in utero, so prior to birth, and they are fully present at birth in order for the newborn to survive. And so we are going to be talking about 3 of those primitive reflexes today. In the clinic, when we work with kids, we look at probably 15 to 25 of those different reflexes. Um, and so they play a huge role in development. So as the child develops, they use the reflex over and over and over again, and that develops their own ability to have a motor movement plan. But it's the reflex that allows them to do that. So one of the classic examples that I give is all of us have had a baby probably where the baby was able to hold his or her head up at a pretty young age. And we've all thought, wow, they're really strong and look at them. That's actually a reflex that when you put your baby on their tummy on the floor, that they will pop their head up. And it's that reflex then that allows them to develop the musculature in their back that then allows them to be able to do that on their own. But it's the reflex that allows them to do something and develop those motor and muscle abilities. So what is the primitive reflex development and integration timetable? So most of these reflexes integrate, or what we would say disappear, within the first 3 to 12 months of life. And so there's different timetable for all of the different reflexes. And, you know, it's as the baby develops and as the baby, again, uses those reflexes over and over and over again, that those reflexes integrate. There are some lifelong reflexes that remain permanent, such as blinking. So obviously very, very important that those lifelong reflexes stay present throughout the rest of our life. Oftentimes the newborn's reflexes are observed and evaluated in the first 24 hours of their life in order to assess their neurological function. And if those reflexes that we would expect to be present when they are born are absent or abnormal, then that sometimes will indicate a significant neurological functioning issue. So in typical development, again, we would expect those primitive reflexes to be integrated within the first year of life as they develop their own foundation for coordinated movements. So why are primitive reflexes retained? Because obviously that's why we're all here tonight. Um, we're because sometimes those reflexes don't integrate, and that can cause difficulty later on in life. So there's lots of different reasons why the primitive reflexes may be retained. Sometimes it's due to a difficult birth or a birth via C-section, trauma, especially in the first year of life, can cause those reflexes to be retained. Um, and that can be both trauma to the infant, but also, um, caregiver stress during those early months of life, abuse, neglect, sometimes children who are in the foster adoption process may also show those retained primitive reflexes. There are some congenital disorders. Really, when you think about some of those congenital disorders, it's probably because the child is developing a little bit differently. So they aren't doing the same repetitive motions that integrate the reflexes naturally. So they're missing some of that. Stress can also cause the reflexes to be retained. And then circumstances that may compromise the central nervous system, sensory system, or motor system. And when I think about that, sometimes there's positioning things that devices that are used, for significant amounts of time with an infant, and so they aren't given the opportunity to move on the floor like they need to in order, again, for those reflexes to integrate. Um, so why is the integration of the reflexes so important? Really, it all comes back to function. And so when the reflexes persist and don't integrate, they will often um, cause functional issues with a child or adult later on in life. And so, oftentimes when we assess a child, there are no kids who are going to be perfect and not have some reflexes present. Same as adults. All of us still have some reflexes that are not integrated. Um, there are times though where we can overcome that, and we use compensatory strategies, and we're able to function, um, and be successful. But with kids, especially children who are struggling, this is the first place we want to look. And we always want to make sure, is it impacting their function? We don't want to work on a reflex and integrate a reflex just to do it. We want to make sure that there's going to be a functional improvement and something that will be better for the child based off of working on the reflexes. So we're going to get started on going through those three reflexes tonight. The first one we're going to talk about is the asymmetric tonic neck reflex. So this is often called like the fencing pose, or sometimes I'll refer to it as kind of the cute little Cupid. So you see your baby laying in the crib and they look like, they're fencing or or a Cupid. And so this reflex is activated by the head turning to the side. So when the infant's head turns to the side, you're going to see the arm and leg on the face side extend. Okay, so you see extension on the face side and flexion on the skull side. And so this reflex is present for a lot of different reasons in development. It helps the baby learn how to roll. It helps the baby discover that they have a hand, which eventually then they bring to their mouth. And so it's a very important reflex. And it should be integrated between 6 and 8 months of age, because by then the baby is able to roll without having to turn their head to elicit that rolling motion, and they're able to find their hands in midline without, necessarily needing to turn their head. So again, this reflex is foundational for eye-hand coordination, to help with survival. Like I said, it's what makes them realize that they have a hand, and then that hand can bring food to the mouth. So if this reflex is retained and not integrated, we'll see a lot of different skills be affected, such as balance, difficulty crossing midline, both with extremities, so crossing midline with hands and legs, as well as midline crossing with the eyes. So visual tracking can be impaired with the presence of the ATNR, and that can impact reading abilities. Oftentimes, this is a reflex that we'll see in children who are diagnosed with dyslexia. It can then also lead to poor handwriting, visual perception difficulties, and then the bilateral coordination, so using the two sides of the body together. Oftentimes, we'll also see kids have letter reversal issues, so kids who mix up B's and D's, P's and Q's, because they don't develop a true sense of midline. And so, when you have rehearsed over and over and over with your child that the bat comes first and then the ball, that's how we know it's a B. But they just don't seem to get it, or maybe they don't know their lefts and rights, so they have difficulty with left and right discrimination, and you've reviewed it over and over and over again, it would probably be a good idea to check for the ATNR. These kids, when they're sitting at a desk, often assume that same pose that we talked about, so they may be writing with their head laying down kind of on the desk that way. And a lot of times too, like if they're going to be cutting a piece of paper, they won't necessarily do it in midline. They'll kind of shift and do things off to one side or the other. Okay. The next one, we're going to come around full circle and talk about what you can do to help with these reflexes eventually. So just hold tight. That part will be coming. So the next one is the Babkin reflex. And so this reflex is elicited when you put pressure into the palm of the hand. What you'll see is that the infant will flex their head forward, and their mouth opens and their eyes close. It promotes feeding early on in life, and it should be integrated in the first 4 months of life. So it's present in order to prepare the infant for nursing and feeding. So if it's retained and doesn't get integrated, you'll see a child or an adult with increased body tension, especially in their jaw and their fists. There may be speech difficulties, including stuttering. A lot of times, if this reflex is present, we'll see kids who do a lot with their mouth, especially during fine motor activities. So they may have their tongue hanging out. They may be licking their lips a lot. They might be chewing on like their shirt, or sometimes their pencils, different things like that. They may be nail biters. This one has also been associated with people with addiction issues and OCD. And it also a lot of times will affect eating. And so we'll see kids with difficulty with eating have a retained Babkin reflex. And then the third one that we're going to talk about tonight is the trunk extension reflex. And so this one is elicited by holding the infant under their armpits. And when their toes touch the hard surface, the response is that their body comes into midline and they automatically have extension of their head and their whole body. So it creates that foundation for body writing. And oftentimes you can think about this one, and it can be seen when you stretch in the morning. This reflex should be integrated between 7 and 9 months of age. So what happens if it's retained? We'll see a child or an adult in a constant fight or flight state. Um, and so they are just always in that heightened sense of alertness. They may have diminished cognitive skills. Sometimes these kids are toe walkers, and they may have a tendency to walk on their toes and walk in a forward posture. And so they look like they're always kind of, their body is ahead of their feet, and that they're always leaning forward. They may also struggle with OCD, might be hyper focused on details with a narrow view of like they're a limited imagination and a narrow focus of perception and engagement with others. So, all right. So what can we do about reflexes that don't get integrated? So there's kind of two schools of thought and two different techniques that can be used most effectively to help children integrate the reflexes. First of all, we would need to assess to determine whether the reflexes are present. And then we would want to come up with a treatment plan, which includes functional activities as well as specific exercises and some manual techniques. And at our clinic, we use the INPP, or the Institute of Neurophysiological Psychology. This was developed actually in the United Kingdom, and is a program that was used for identifying and assessing neuromotor immaturity or reflex presence in children and adults. And then there's also the Mostakova neurosensory motor integration method, or MNRI. This is another one that we utilize in our clinics. It was developed by Dr. Svetlana Mostakova, and it is a very concentrated reflex integration work. And so it involves a lot of manual techniques, and really works at the underlying neurosensory motor dysfunction. So again, we want to make sure that when we are assessing reflexes and when we are treating them, that we are impacting function. It's all about function. And so we want to use techniques that are going to give the best results. So those are the two techniques that we utilize. So AT&R, reflex integration activities. So I'm just giving you some activities tonight that you can easily do with your own kids at home, whether or not they have these reflexes present or not, because you'd need to get them assessed in order to determine that. But these exercises and activities are just fun activities that anybody can benefit from. So the first one is just having a child kind of do like a piggyback ride, except the person's on all fours and the child is moving from side to side and they're trying to fight to stay on their back. And so what this is going to do is cause the child to have to do a lot of body righting. And so they are going to flex their trunk in order to stay on. And it's just a good, fun, functional activity. Sucking on a sucker or sucking through a straw is another good activity to work on the AT&R, again, because it's bringing everything back to midline. And that's where these kids struggle. So if you think our mouth is about as middle as it gets, and so utilizing our mouth during activities is a good way to work on that. Crawling while holding a beanbag under their chin. So they're holding an object under their chin and they're crawling on all fours. What this is going to do is keep their head in midline, because a lot of times these kids with the AT&R, when they're crawling, are going to be turning their head side to side as their hands and legs progress. So by keeping their chin in midline, they aren't able to do that as much. And then any midline crossing activities. So crisscrosses where they're bringing elbow to opposite knee, windmill toe touches are great. We will do a lot of times crisscrosses like to the knee and then touch the opposite foot with the hand, and even do cheek to cheek, ear to ear, and get a lot of that midline crossing activity. So Babkin reflex integration activities. So the Babkin, again, is the one where if you push the middle of the palm, the mouth opens and the eyes close. And so there are hand activation points, and those would be specific exercises that we would teach you. Also crawling on hands and knees and putting an object in the hand while you're crawling. So you'll see farther down the list, they're like putting a tennis ball in the palm of the hand and then crawling, just because it gives, again, extra input to those Babkin points. Opening the gates. So you're going to have the child slowly open their hand and their mouth. And when they have their hands and mouth fully open, you put like a little treat in their mouth, you know, popcorn, raisin, Cheerio, whatever, but they're working on opening slowly and together, their hands and their mouth. Squeezing a rubber ball in the palm of the hand or other types of fidgets. This reflex has a lot also to do with helping calm. And so sometimes you'll see people who are really nervous and they might be writhing their hands and kind of fidgeting like that. Well, that's because without even knowing it, they are activating their Babkin spot, which is releasing those endorphins to their brain to help calm. And so this is why sometimes fidgets are good for some of those self-regulation things. Have your child hold a coin in the palm of their hand, and then the adult gives resistance to the hand while the child tries to open it and drop the coin on a target. You can play burst the bubble. So that's very similar. Adult covers the child's hands, adds resistance, and the child tries to pop their fingers through the adult's hands. Using different tools, such as like an Old Spice container, and pushing them down with the palm into make imprints into Play-Doh. Those types of things are also great for the Babkin. Trunk extension activities. So doing full body stretching in various positions, such as seated, standing, and lying down. Heel to toe rocking. So they're standing and they're just rocking from their heels to their toes. So they're kind of going back and forth. Trying to reach up as high as they can to put a sticker on the wall. So sometimes we'll do this in the clinic and have kind of a target, and then they have to see if they can put the sticker higher than the target. Measure how long you can stretch out while laying on a chalk or a tape measure. Just kind of a fun activity for kids. They all like to try and beat their last score or whatever. Hanging something in the door frame and then having them try and reach for it to try and touch it. So various items can hang from the door frame. Laying down with your heels against the wall, and then you're going to lift the leg up with your knee extended or locked and try to strike the wall while lowering it. Again, you're just working on elongating the whole entire trunk. And then holding a cup in the shower and trying to catch all the water. So then, they're stretching up toward the spigot and trying to catch the water into the cup. So if you work on these 3 reflexes, there's various results that you should hopefully see. So if we work on the ATNR, we should see improvement in the child being able to differentiate between the left and the right side of their body, especially if a child has difficulty with hand dominance. So let's say, your child is 5, 4 maybe, and you're not really seeing a hand dominance. It could be because the ATNR isn't integrated. And so by working on it, you should see that dominance naturally appear. Improvement and development of various perception. So the ATNR, I didn't mention that earlier, but it is very tied to auditory processing. Again, think of it because if the ATNR is still present and the child is moving their head and it's impacting their extremities, that's also going to impact their listening skills because of whichever ear they're bringing toward the auditory input. So when we work on this, we oftentimes will see improvements in auditory and speech recognition and just improvements in their auditory processing. You'll also see improvements in eye-hand coordination. Again, this one limits the child from developing a true sense of midline. And so if they don't have a true sense of midline, there's a lot of different activities that use the two sides of the body in reciprocal motion, riding a bike, swimming skills, as well as like batting a ball, where they aren't going to be crossing midline and they're just going to have more coordination issues. You may see improved academic performance. Again, like I said, this one is very tied to dyslexia as well as other visual perception issues. And so letter reversals, crossing midline visual tracking is going to improve reading. So lots and lots of different implications with this one. Again, you'll see improved ability to cross the midline, which is going to improve bilateral coordination. So using the two sides of the body together. And whenever we can use the two sides of the body together, our brain function is just going to improve because the communication between the two sides of the brain is also going to improve. So pretty important reflex. Babkin reflex integration implications. So again, like I said, this one has a lot to do with tension in the fist and the jaws. So you'll see maybe improvements in some of that, which is then going to improve speech. You will see less movement of the mouth during fine motor activities or any motor activity. I've done this one with kids in the clinic, and kids will go from, we were doing a medicine ball toss. So I was just having the child throw the ball with one hand against the trampoline and the ball was coming back and the child was licking his lips just excessively. And so we took a little break and I did the Babkin technique and he went back and he started throwing the ball and nothing was happening with his mouth. So I switched hands, had him start throwing with the left hand, mouth started going again. So we did the technique again and again, just saw a significant decrease in those oral motor movements during that activity. And, you know, as you work on this one again, over and over and over, you should see that will stop almost significantly. So you'll see decreased nail biting, pencil chewing, again, the oral stimulation if you have a child who chews on their shirt a lot or chews on other objects. This one is a good one to look at. And then trunk extension implications. So again, this one is going to have a lot of improvement in cognitive skills. You'll see decreased toe walking. You'll see a more calm state because they are no longer functioning in that fight or flight state. This one, again, like I mentioned earlier, a lot of times these kids are hyper focused on details. They might be excessive talkers because they're so hyper focused on details. So they're constantly asking questions and constantly commenting about things. But when we work on this, they're able to see the whole picture. And so we'll see some of those behavioral issues decrease, and they have an improved imagination. So how do you achieve successful primitive reflex integration? So again, it's about assessing to make sure that these reflexes are the ones that are impacting your child's function, and then looking at a therapy program to help. The activities that I gave you tonight are a great place to start. But if you wanted to really, really look at, you know, in a more concentrated manner, you would want to have the exercises. If you think about how these reflexes naturally get integrated in infancy, it's because the infant does the movement over and over and over and over again, hundreds of times. And so in order to get the best results, you're going to do basically those same things over and over and over again, just as an older child. And so it's critical that a home program is followed and that the child is doing it at the prescribed amount. Um, so if any of this is intriguing to you and you're curious about your own child's function, we always offer free screens. And so you can take a little picture of this QR code and that will lead you to a form that you can fill out if you are interested in the free screen. If that's too technology challenging, because that would be me, you can also just email us at Kinetic Edge or go to our web page and contact us through that, and we'd be happy to set you up with that. And then also here is my email address and our Pella Clinic number. We do offer occupational therapy with primitive reflex integration in Oskaloosa, Pella, Newton, and now Des Moines. So yeah, we're excited to be expanding our services. And again, it's all about function. So we want to make sure that, you know, when we're looking at a child's functional abilities, that we start at the very foundation. I think that there's often times where we work on skills with kids and we start to feel like we're beating our heads up against a wall and they're getting frustrated because all they've done is rehearse, rehearse, rehearse and practice, practice, practice. But if they're practicing it wrong or you know, we haven't looked at the most foundational level of where the difficulties might be coming from, it's just a source of frustration. And so I really feel like since we've been doing a lot more of the reflex work in our clinic that we've taken away hopefully some of that frustration for parents. So what questions do you have? Again, I can't hear you, but you can use the little question and answer bubble up there at the top for any questions that you might have. This was a pretty quick presentation, but hopefully you gained some knowledge. If you joined us a little bit late and you want a copy of the video, we can email that too because this whole presentation was recorded. So we're happy to do that. You can just maybe comment again in the little Q&A bubble here and let me know if you'd like to have the presentation emailed to you. I know one question was, how can I get my child to pay attention or focus better during schoolwork? The ATNR is a very alerting reflex. And so that one, again, has a lot to do with auditory processing and visual perception. So doing midline crossing activities prior to schoolwork, as well as, you know, specific ATNR exercises would be very, very helpful. Those are ones that you don't want to do at like 2 hours before bedtime because they are so alerting. So, you know, doing those exercises in the morning would be very helpful. Same thing as trunk extension. So just doing a lot of stretching, reaching tall, being, you know, making yourself tall, trying to, you know, the different activity ideas, those two would be very good for a child prior to doing schoolwork because they would help release endorphins to the brain. Also, that would help with their concentration. Any other questions that you have? I'll wait like 30 seconds. I'll probably be doing additional reflex integration seminars highlighting some different reflexes. Usually we try and do 3 at a time. So you can watch our Facebook um, page for that, or if you are interested and want to make sure that you hear about that, let me know and I can include you on an email, because I haven't set a date yet for that. But it'll probably be another evening activity. So, all right. Well, if no, oh, there's a question. What is the age range of children you work with? Um, Really 0 to 80? No, we're all kids at heart, right? No, really, it's probably 0 to, I've also worked with kids who are in college, who struggle with different things. And so the really awesome thing about the brain is that it is forever changeable. And so, um, our, neuroplasticity is amazing. And so it's never too late to work on some of these skills. When we see kids who are early or who are younger, because I say 0, but we wouldn't necessarily teach reflex integration exercises to kids who are, in that 0 to 1 age, and even 1 and a little beyond. We probably wouldn't do the specific exercises, but we would do activity guides, because while we say that the reflexes should be integrated usually in the first 12 months of life, there is always room for that child to integrate them on their own later. But again, it would also depend on their function. And so if we're seeing some significant functional issues, we would definitely work on those reflexes, once they're past the age of 1. So, um, hi, Angela. Do reflexes affect bedwetting? Absolutely. So I did not talk about the reflexes tonight that have to do with bedwetting, but spinal galant and spinal parese are 2 reflexes that definitely impact bedwetting. And I can talk to you more about that when I see you too. But those 2 reflexes have a lot to do with our interoception, and so our ability to sense internally how we feel. So do we have to go to the bathroom? Are we hungry? Are we hot? Are we cold? Some of those internal sensory experiences. And so when a child is bedwetting and there isn't a physiological reason, why that bedwetting is occurring, we've had excellent success with spinal galant and spinal parese as the 2 reflexes to work on that. Any other questions? These were good ones. Again, I just would encourage you. I always believe in looking at the most foundational thing that we can look at. And so looking when we're struggling with our kids, and they're struggling, and that's no fun, really don't, we all just kind of want our kids to be joy filled and happy, and, have the best opportunity that they can. They don't need to all be rocket scientists, but if we can help them have things be a little bit easier for them, I just think that's so important. And so really looking at the bottom up, and how we can help kids that way is, I think, just really critical. I mean, there's so many different, I think, like one of the common things I often get asked as an occupational therapist is, what do you think about pencil grips? Because my child isn't holding their pencil correctly. Well, we could give a child a pencil grip and they could hold on to that pencil grip, and yeah, it would improve probably the mechanics of their hand. But I always like to look at things and layer it back. So why are they not holding their pencil correctly? Why are they having trouble with that? And oftentimes it's because one of the Palmer reflexes isn't integrated. And we talked about Babkin, but we didn't talk about the other ones. And so why wouldn't we want to make it possible for them to improve their fine motor skills and hold a pencil correctly by, changing the brain versus just putting a band-aid on it. And so that's really where my passion lies, and why I feel so strongly about this work. So, any other questions? All right. You've been a great audience. I hate the fact that I can't see you. I feel like, why can't we just have, the nice little pictures here of you guys as well? But please reach out, shoot me an email, give me a call if you have any other questions. Sometimes after the fact you think of something. I am more than happy to answer questions. So please feel free to reach out. And with that, I will let you move on with your evening. So thanks so much for joining me. Have a good night.